Good evening, everyone, and thank you for joining us. A very warm welcome to you. My name is Kerry Tocock, and I'm the Head of Communications, Marketing and Events here at Wiltshire Council. Just going to give you a quick introduction to how this evening's update will work, and then we'll get straight on with the session. If you wish to see closed captions of the speaker's words, then please click on the CC button on the bottom right of your screen, and they should then appear after 30 seconds or so. The system sometimes takes a little while to get warmed up. If you're having any technical problems, the most common solution to these types of issues is always to switch the system on and off again. So please close Teams or your browser, reopen it and click on the meeting link again that was sent through earlier. Other problems could be down to your own home internet connection, or if you're hearing an echo, it may be that you have the event open in 2 or more windows. For the Q&A element of tonight's session, we asked for your questions to be submitted in advance, and thank you to everyone who wrote in. We received a great response. Obviously, we're unable to answer all of your questions this evening, but what we've done is grouped them into key themes, and we'll try and cover as many points as possible during the session. However, if you have any additional questions, you can submit these via the chat panel, and again, we will try and answer these during the session. You can also see the slides on your screen now, and over on the other side, you should be able to see the Q&A panel. For some of you, it may be beneath your screen and you'll need to scroll down to see it. You may need to click on the icon of 2 overlapping speech bubbles to open this panel. We will also use this panel to make any announcements during the session. So that's all from me, and I'll now hand over to Councillor Philip Whitehead, who will get us underway. Oh, sorry, Philip, you're actually on mute there.
That was a brilliant start. Hello, everyone. I'm Philip Whitehead, leader of Wiltshire Council. Thanks for taking the time out to join us tonight for our second COVID-19 public update. We had some great feedback about the last update that we did a few weeks ago, and as somebody who doesn't always get positive feedback in the email, it was most welcome, and we do appreciate it. Next slide, please. I'm pleased to say that joining me once again tonight is Terence Herbert, Chief Executive for Wiltshire Council, and Kate Blackburn, Director of Public Health for Wiltshire. Both Kate and Terence will provide updates, and then we'll spend a good chunk of the session answering your questions. We're very aware that you get bombarded from all angles with talk of regulations, restrictions, statistics, do's, don't do's, etc. So our aim tonight is to try to cut through some of the noise, simplify things, and hopefully at the end of the session you'll be better informed than when we started. Before I hand over to Kate, I just wanted to take this opportunity to thank you all for continuing to play your part in beating COVID-19. It's been a real nasty year, a longest year I can ever remember, but every single resident of Wiltshire reacted well in the communities to everything that's been asked of you. And it's that type of spirit and attitude that has helped us get to the other side of this and towards a more positive and hopeful 2021. And I'd like to stress that the attitude of the people of Wiltshire really has made a significant difference. So on behalf of everyone at Wiltshire Council, thank you for the efforts that you've put into this problem. Right, I'll now hand over to Kate, who will provide you with a local public health update.
Thank you very much, Philip. Good evening, everyone. I'm Kate Blackburn, Director of Public Health for Wiltshire. I wanted to update you on the current situation regarding COVID-19 in the Wiltshire Council Local Authority area. So if we could pop onto the next slide, please. As you will all know by now, we are currently in the Tier 2 high level of the government's COVID alert system, and you can see on the slide a brief overview of the local restrictions for areas in Tier 2, such as no mixing of households indoors apart from with a support bubble, and only meeting up to a maximum of 6 people outdoors. And this slide, if it's useful for you, is available on our website, on the council website. I firmly believe that Tier 2 is the right tier for us at this time, even though I know it places restrictions on who we can meet and how certain businesses can operate. I know how tough it is not being able to see as many loved ones at the moment, but Tier 2 gives us a good opportunity to get our case rates down. And if we were in Tier 1, the evidence suggests that numbers would almost certainly increase. If we could move to the next slide, please. So we have the latest data, which shows that since the pandemic began, we have had 5,429 confirmed cases in Wiltshire. And the rate of cases per 100,000 population in Wiltshire in the last 7 days is 77. Now, this is a reduction from 2 weeks ago when it was above 130. And if we could move to the next slide, please, we can see how rapidly the decline in cases happened in Wiltshire in the last week of November. Prior to the national restrictions, we were seeing the worrying trend of case numbers in Wiltshire rising rapidly, and it's encouraging that case numbers are heading in the right direction, which was very much a result of the national lockdown restrictions in reducing viral transmission. However, over the last week, we have seen that decline start to slow and begin to plateau, and so it's really important that we stick to the restrictions and guidance so that we don't see cases start to rise again within Wiltshire. So if we could just pop onto the next slide again, please. I just wanted to show a little geographical context. So this graph includes our surrounding local authority areas. So on the graph, Wiltshire is the thick red line, and you can see that as a broader area, we all have very similar rates and patterns of transmission at the same time, with the exceptions really being South Gloucestershire and Bath and North East Somerset, and their higher rates of cases were very much linked to their student populations. So I'm really pleased that the impact of the national restrictions and all of your superb recent efforts have managed to reduce the rates in Wiltshire, and they've put us in a better position as we head towards the Christmas period. And we really want to ensure that we can enjoy Christmas safely and still keep those rates as low as possible. So you'll be aware the government is allowing us to form a Christmas bubble with 2 other households between the 23rd and the 27th of December. And I'm sure many of you are looking forward to seeing more people. Now, I certainly don't want to be the Grinch and steal Christmas from you, but all I ask is that you be as cautious as you can be over the Christmas bubble period. If you're planning on having a bubble at Christmas, please carefully weigh up all the risks of who you have in it and how many people you see, and please limit the number of people you see if you can. Many of us over Christmas will be looking forward to relaxing and putting our feet up, but that's something the virus won't be doing. And so although I've said it before, this virus likes people. And so if there's a big group of you together, the risk of it spreading increases markedly. So we now have some good news with an approved vaccine starting to roll out as we speak. So it's looking much more likely that next year we'll be able to enjoy occasions like Christmas again with all the people that we love. But until then, we still have to keep our guards up. And this is so important when we think about the actions we must take, such as isolating and getting tested if we show any signs of COVID. We are starting to see a slight decrease in numbers attending our test centres. So if you have any of the COVID-19 symptoms, a high temperature, a new and continuous cough, or a loss of taste and smell, then please do the right thing and book a test as soon as possible and self-isolate until you get the results. We are seeing a very quick turnaround of people booking a test and getting the results now. So to keep everyone safe and for your own peace of mind, please do get a test if you need to. And our test centres will be open throughout the Christmas and New Year period. I just wanted to highlight that after the October half-term school break, which was a time when families came together and spent more time with other people, we did then see a sharp rise of cases that were associated with schools in the following weeks. And this is something that we're really desperate to avoid in the new year. So I wish you all a very cautious Christmas, which is probably something you're very unlikely to see as a Christmas card message for this year. And finally, I do just want to reiterate that the best things we can all do to help us keep this virus under control in Wiltshire, and my apologies because you will have heard me say this again and again, but they really do work, is to limit the number of people we come into contact with, keep regularly washing hands, wear a face mask where you need to, and please self-isolate if you're required to do so. So thank you very much, and I'll now pass you on to Terence.
Thanks for that, Kate. Good evening, everyone. I'm Terence Herbert. I'm the Chief Executive of Wiltshire Council. So as Philip said in his introduction, a lot of you found this briefing really useful last time. So I'm really pleased to be able to come back again to talk to you through what we're doing at the Council to support you during this period. It's probably the understatement of the week, but at the turn of the year, none of us could quite envisage what 2020 would turn out to be. And we at the Council have had to adapt at quite an incredible pace. Now, although our plans for the year had to be changed considerably, one thing remained constant, and that's that we continue to deliver high quality services that you rely on. I've said this a number of times in a number of different forums, but aside from the NHS, the government has entrusted local authorities to undertake the majority of the public sector response to COVID. Now, these have included managing a number of grant schemes to support businesses, where we've actually ported out over £99 million in business grants, setting up wellbeing hubs to be there for people who need us, delivering food parcels, informing residents and businesses of all of the latest guidance and regulations, locally running a number of schemes to support residents financially, supporting schools and businesses during any COVID-19 outbreaks, and making sure they have all of the information that they need. Now, that's not everything that we've been doing, but that's a few of the different services we've provided, and it's been challenging, but that's our job. We're at the council are very proud public servants, and it's never been more evident than in times like these. But we're empowering our communities, as that's one of our important roles as well, and we're really pleased to have built up a network of Wiltshire Together community champions. So they're helping get information and key messages out to where they need to be, and it's fantastic that we've got a series of trusted voices behind us. Now, you may have seen our champions out and about in the local area, and we'd like to thank our partners for their support, including those in the voluntary sector and our town and parish councils. There has obviously been an awful lot of talk about council finances this year, particularly as income streams have been really affected by the pandemic. And we can't deny that this has certainly been the most financially challenging year since Wiltshire Council came into being in 2009. However, through the swift action earlier in the financial year and introducing spending controls, together with some emergency government funding, we're pleased that we're now forecasting to balance the budget by the end of this financial year. And unfortunately, that's not the case with all councils. We're expecting the next budget setting process to be tough though, and it's not easy given the unpredictable nature of the circumstances we find ourselves in. However, be rest assured that we're working hard behind the scenes to make sure we're in a good position to help the county recover from the pandemic. So as well as maintaining roads, emptying your bins, providing leisure and library services, protecting children and vulnerable adults, and all the other 400 or so services that we provide. When we do emerge at the other side of this, the impact of COVID-19 will unfortunately be felt for some time to come, and we'll ensure that we focus our time, money and resources to help the county get back on its feet. Our Wiltshire Wellbeing Hub, which you can see on the slide, will be in place for as long as it's needed. If you don't have a support network around you and you need advice or help, don't hesitate to get in touch. No matter how small you think the query might be, we're ready to help you. So the Wiltshire Wellbeing Hub will also be responsible in ensuring those pupils and families who are in receipt of free school meals are able to receive the much needed funds and support during the Christmas break. And the COVID Winter Grant Scheme provides funding to local authorities to support families with children, other vulnerable households and individuals most in need, with the cost of food, energy, water bills and any other associated costs. Under the scheme, Wiltshire Council has received a ring-fenced allocation of £1,107,000. So funding can be provided to eligible residents through cash, through the provision of food vouchers or via funding through third-party organisations. Now, we've all been really buoyed by the news that a vaccine's been rolled out. And the first vaccination was given to a 91-year-old woman from Enniskillen in Northern Ireland today. And we in the council will be supporting a massive logistical operation in many ways. And we will be clearing the path that will lead us towards some sort of normality again. I must say, though, that when you're offered the vaccine, please take it. We have heard lots of plain daft and dangerous conspiracy theories. Ignore them. These are from people with too much time and too little sense. Listen to the scientists and medics and make sure you get vaccinated. As Kate said, we have to be patient and we have to keep following the guidance until we get vaccinated. We know that so much has been asked of you, but your efforts are definitely not going to waste. The statistics prove it, so please keep going, as hopefully we're not too far off the home straight. So now we're going to move on to the Q&A part of tonight's briefing.
Thank you, Terence. So as I said at the beginning, we've grouped the questions into themes. So first of all, we're looking at Tier 2, the high alert and case rates. So Kate, could you tell us a little bit, Wiltshire's case rate numbers are going down. So how does the government determine which areas go into which tiers? And when is it likely that the county could be moved into Tier 1?
Thanks, Kerry. So as we know, Wiltshire was moved by the government from Tier 1 medium alert to the Tier 2 high alert category after the lockdown. And the initial tier system was not really having sufficient influence on reducing the rate of onward infections. So like many areas, Wiltshire saw a significant increase in cases during the previous tier system. Now, the allocation of tiers is primarily based on 5 key indicators, which will be reviewed again by central government on the 16th of December. And those indicators are our case detection rates in all of our age groups, the case detection rates in the over 60s, the rate at which cases are either rising or falling, something called the positivity rate, which is the number of positive cases detected as a percentage of all tests taken, and then also the pressure on the NHS, including both current and projected occupancy. So the government will make that decision on the 16th of December. I think it's also worth noting that the government decided to combine Wiltshire and Swindon as one area, and so we work very closely with Swindon, and the single tier allocation has strengthened that partnership further. But as previously mentioned, the case rates in Wiltshire have recently been falling, and with our population's continued action, we hope that reduction will continue. The moment the county moves to Tier 1 is ultimately down to all of us as individuals, so our continual awareness, acceptance and adherence to the guidance will reduce the spread of the virus. It will save lives, and at the right moment it will allow us to move into Tier 1.
Thank you. And how and with what urgency are the sources of the COVID-19 cases across Wiltshire being investigated and dealt with?
So locally, the public health team look at the cases on a daily basis. Any patterns that are spotted in the cases, such as location clusters or settings, are investigated immediately. Certain settings, such as care homes, schools and businesses, we have specific local public health teams dedicated to supporting the response in each of those settings, and that's very much with our other directorates within the council to make sure it's a wraparound support. We did also, in the questions that came in, have a question about whether Wiltshire data includes that from the many military bases in the county, and I just wanted to say here that the answer to that is yes. Any location in Wiltshire that is tested through the national testing sites is included, and of course we're working very closely with the military, who've been integral in assisting our response to the pandemic.
Lovely, thank you, Kate. And the next set of questions are about the vaccination, which we've obviously talked about previously. And again for Kate, could you give us a little bit of an update about the new COVID-19 vaccination?
Yeah, certainly. Thanks, Kerry. So further to the government's announcement on the 2nd of December of a coronavirus vaccine developed by Pfizer-BioNTech has been approved for use in the UK. And as Terence referenced earlier, that first dose was given today. You will have seen news around the mass vaccination programme, and that will begin its rollout across the UK from today. The vaccine has met strict standards of safety, quality and effectiveness as set out by the Independent Medicines and Healthcare Products Regulatory Agency. So I would absolutely reiterate Terence's comments of earlier of the vaccine is safe, the vaccine works, please take the vaccine if you're offered it.
Thank you. And when will Wiltshire residents be able to get the vaccine, and how will people find out when they're eligible to get the vaccine?
So I think actually if we can click on to the next slide, we should have a nice graphic here. Thank you. So the local vaccination programme is being led by our colleagues in the NHS Clinical Commissioning Group, who've been working in collaboration with a wide range of partners, reflecting this rapidly evolving picture that's emerging nationally. So those eligible will be contacted directly. And at first, the vaccine is going to be offered to people who are most at risk from coronavirus. So the vaccine will first be offered to people who live in care homes and care home workers, people who are aged 80 and over, and health and social care workers in England. And that final decision on who will get the vaccine first follows advice from the National Joint Committee on Vaccine and Immunisations.
Thank you. And where will people be able to get their vaccinations?
So delivery of the vaccinations will be rolled out at identified sites across the Bath, Swindon and Wiltshire footprint, and these will be coming out in terms of where they're located over the next coming days and weeks, so that everybody is very aware of where that will happen.
And will the vaccination affect the tier system at all, and how will it affect the tier system?
So I think at the moment that's unknown. It's the government who are deciding the indicators as to where people are placed in the tier system. I think the key thing to note is that while the vaccine may help protect you from coronavirus, it is still vitally important to follow social distancing guidance and other restrictions to keep each other safe.
Thank you, Kate. So moving on to a couple of questions about schools. Terence, could you tell us why are children not being automatically tested for COVID-19 at school, particularly when a year group is closed and children and families are having to self-isolate?
Yes, I can, as soon as I, on the mute button there, sorry, Carrie. Before I answer that though, I just wanted to thank everybody associated with schools, all the way from the head teachers, principals, school staff, parents, everyone really, carers, and of course the pupils. I believe that schools are certainly the best place for children to be at the moment, and when we have seen a positive case at an education setting, the school's management teams have had the measures in place to deal with it as effectively as possible. We know that's meant some disruption caused to families because pupils are having to self-isolate, and we obviously thank everyone for their patience if this has happened to them. It's been a bit of a learning curve. So in answer to the question, nationally pilots in certain schools and areas have been taking place with mass testing, and we understand there'll be further communication about that next year, but it's a national decision around testing in schools.
Thank you. And with regards to schools closing for Christmas, is there no option for schools to close 1 week earlier on the 11th of December in the same ways that universities have?
No, it's not. It really wouldn't be appropriate. Pupils have missed a significant amount of time in school, and it's really essential that they don't miss any further schooling. Families did a great job with home teaching. I'm a parent, I've got 2 children at school, and I can tell you from personal experience that kids really need to be back in school to ensure that they catch up on the learning that they missed between March and the summer break. A large number of the COVID cases in schools have been due to community transmission, not in schools themselves. So schools are actually a safe place to be, and term ends on the 18th of December. So it's not that far away.
Lovely, thank you. And another series of questions here for yourself again, Terence, regarding care homes. So firstly, I have a relative in a care home, so could you tell a little bit about the latest guidance on visiting loved ones in care home settings, and where can I find more information about what I have to do before, during and after my visit?
Okay, so the new national guidance on visiting for care homes was published on the 1st of December 2020, and that guidance highlighted how developments in the recent testing technologies are being used in order to mitigate the continued risk to health of COVID-19 for residents and staff in care homes. Across Bath and North East Somerset, Swindon and Wiltshire, that's our NHS footprint, we continue to recognise the benefits of care home visits for the well-being and for the quality of life for the residents and their families. And we're really pleased to see that a national position that allows these visits to take place across all tiers, except obviously when there's an outbreak in a care home itself. So the national rollout of the lateral flow, or the rapid COVID testing to care homes, is a really welcome development in our response to the pandemic. Now, whilst rapid testing can reduce the risks around visiting, it doesn't completely remove the risk of infection, and therefore it's pretty vital that care homes and visitors continue to take robust infection prevention measures. So we're also pleased to see the rollout of lateral flow tests to allow visitor testing in care homes, and it enables care homes to offer regular testing of visitors when it's combined with the other prevention control measures like PPE, and that allows for safe visits with loved ones. So to sum up, across Wiltshire, care home visiting should be supported and enabled where it's possible to do so safely. That's in line with the guidance and within a care home environment that really uses the robust practices for infection and prevention control.
Thank you. And will all care homes offer the same opportunities to families to visit their loved ones?
Well, each service or provider is pretty unique in terms of their layout and of the people that are supported. In line with the current practice and the Care Quality Commission's advice, care home managers are continuing to risk assess their visiting procedures, and that has to take into account their specific circumstances. So these reflect the individual situations, like the layout, and the care home will have their own visiting policy in place, and they'll work with families to ensure that they know how to arrange and conduct visits safely. If there is an outbreak in a care home, restrictions on visiting are immediately put in place, subject to exceptional circumstances such as any end-of-life visits, and that's to protect the vulnerable residents, staff and visitors.
And are people able to visit family members who live in care homes that are in a higher tier to Wiltshire? So obviously at the moment in a tier 3 area.
So care homes in tier 3 areas are still able to accommodate visits. However, as before, the specifics around the visits vary from home to home. It's advised that families link directly with the homes to ensure they know what can or can't be accommodated for their personal situations.
And finally, are care home residents able to leave residential care to form a Christmas bubble with families indoors during the 23rd to the 27th of December?
Okay, so for the period 23rd to 27th, care home residents under 65 may be able to join their families in their homes. That's subject to an individual risk assessment being carried out, a negative test before leaving, and also a period of self-isolation upon their return to the care home. However, they may only form a bubble with one other household and shouldn't form a 3-household Christmas bubble at any point. And that applies to all tiers and will allow families to safely have contact with their relatives during the Christmas period.
Lovely, thank you, Terence. And moving on, but sticking with the Christmas theme, Kate, would you be able to give us a little bit of an update on the government's COVID-19 guidance for Christmas 2020, please?
Yeah, of course. Thanks, Kerry. So the festive period will be different this year. Of that we have no doubt, but we've made such progress, and I'd like to thank everyone for the efforts now and into the future in terms of what we've been doing to really support Wiltshire to keep our case rates as low as possible. So in terms of what you can do this Christmas, it is important that you follow the latest national guidance. And so, as we said, from the 23rd of December to the 27th of December, you may choose to form a Christmas bubble with up to 2 other households. Now, if you do form a Christmas bubble, you should not meet socially with friends and family that you do not live with in your home or garden unless they are part of your Christmas bubble. In all other settings, people should follow local restrictions in the tier in which they are meeting. And if you do not form a Christmas bubble, you should continue to follow the guidance for the tier that you are in. But I think it's really for me to stress, please think very cautiously about who is in your Christmas bubble and how many people there are. And it's really important that we carefully weigh up all the risks of that.
Lovely, thank you, Kate. And I think your answer covered the second part of the question here. Can I form a Christmas bubble if it's in a different tier to my own? So if we move on to, is it safe for people to travel into the UK or to travel abroad?
Okay, so in terms of travel, as we live in a tier 2 area, subject to nothing changing on the 16th of December, and of course we don't know about that yet, you must continue to follow tier 2 rules when you travel to a tier 1 area. Really, you should avoid travel to or overnight stays in tier 3 areas other than where necessary, and that's for things such as work, education, youth services, to receive medical treatment or because of caring responsibilities. But you can travel through a tier 3 area as part of a longer journey. Between the 23rd and 27th of December, you may travel between tiers and other nations of the UK if that's necessary to meet with other households in your Christmas bubble or to return home. But once at your destination, you should follow the rules of that tier. In terms of travel abroad, in England, people are currently permitted to travel abroad subject to any restrictions in place at their destination. However, those in tier 3 should avoid leaving the area other than for reasons such as work, education or caring responsibilities. Inbound international travel will continue to be governed by the travel corridor approach, and all arrivals will need to abide by the regional restrictions in place when in the UK. And full guidance on travel can be found at the gov.uk website, which I'm sure we can put up onto our council website later on for people to access.
Lovely, thank you, Kate.
Thank you.
And our final topic of the evening is supporting the local economy. So, Philip, people that want to support Wiltshire businesses and shop out or eat out locally, especially in the run up to Christmas, what is the new guidance around shopping and going to pubs and restaurants for tier 2? And will there be checks to ensure measures such as social distancing rules are observed so that people feel reassured that it's safe to shop in person rather than just online? You're still on mute, Philip.
See, such is life. Perfect. Do it every single meeting. Local shops, pubs and restaurants are open and operating in line with Tier 2 high alert guidance. And more information is available on our website and on the gov.uk website. High alert means that you must not mix indoors with anyone who is not part of your household or support bubble. You are able to visit hospitality venues such as pubs and restaurants, but they can only serve alcohol with a substantial meal. And if you visit with people who you don't live with, you must sit outside. So instead of going for a drink at the pub and everything else, why not go for a nice big meal where you spend the money with the pub having a big meal rather than individual drinks? You can manage it in a different way this time. You can only meet up with up to 6 other people you do not live with. This is the rule of 6. Pubs and bars must stop taking orders after 10 and must close between 11 o'clock and 5 in the morning. If you do head out to enjoy an evening with friends or family, and because you're drinking, you're not driving, we recommend booking a taxi at the start of the evening for your journey home, because that then avoids queues at taxi ranks or groups of people gathering outside pubs. It means your taxi is going to be there and you can get home safely. In terms of shopping locally, we would encourage anybody to shop local and support the local businesses. And we've created a very helpful Shop Local Support Wiltshire directory, which is available on our website. You can select a local town in Wiltshire, and the directory highlights local retailers and small businesses. Now, you may not always be able to go and visit these, but these businesses may also be offering options to buy online and click and collect. So rather than just go online and order from some national person, why not go online and order from a local person or go and visit these shops directly? They'll all be operating COVID-19 restrictions, and therefore you'll be safe to shop in them. With Christmas coming, why not shop local for gifts and support our fantastic independent businesses across Wiltshire? Don't forget, when you're heading out to a shop or to visit a bar or a restaurant, you will need to wear a face mask indoors unless you're exempt. I know from personal experience now, I pat my pockets for the wallet, the glasses, and now the face mask as well. As we mentioned earlier, we've also launched Wiltshire Together Champions, who've been helping to install social distancing signage in high streets across Wiltshire and handing out posters and flyers to shops and members of the public, reminding them of the key public health messages. Thank you to all our residents who've signed up to the schemes and helped share messages on social media. Also, just to remind local businesses who were forced to close during the national restrictions or have been severely impacted by coronavirus, they may still be eligible for a grant. This is a grant, it does not have to be paid back, so please make sure you get application in. And even if you got an application in and received some money at the start of the year, the new scheme is out, so please apply for this end of the year as well. Details are on our website, and if you have any queries on the support available, you can contact our dedicated business support email address. For further information, as shown on the slide and on the second slide as well, in terms of the channels that you can contact us. Thank you. That's all from us this evening. Thank you for spending your time with us, and thank you for logging in and thank you for sending the questions in the first place. We'll continue to do these sessions as long as we hear that they are useful to you, and I'm sure you'll see us again at some point in the new year. We will put a recording of this entire episode on our YouTube channel, if I can get the words out. So please keep a lookout for that and share if you can to other people, because then that means that people who didn't manage to log in or just weren't aware of it happening tonight, if you share it on social media, they can then look at it in their own time. If you have any feedback, please email our communications team at communications@wiltshire.gov.uk. And if you haven't already, please sign up to our weekly newsletter. So you just need to give an email address, and that signs you up to our weekly information outlet, and then we'll email you on a regular basis. Finally, it might not be a traditional one, but regardless, we hope you all have a very happy and healthy Christmas. Take care, bye for now, and don't forget to wash your hands, wear a mask, and socially distance. Goodbye.